We will now start our pep talk this afternoon. I'd like to remind everybody, please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Include the names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. Another reminder, after the pep talk, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. The link has been placed in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one to a voucher for a ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. We will now have a group picture taking before we start the pep talk proper in 2 minutes. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm and perseverance. My pep talk today is entitled Rabies Awareness. This is in consonance with the DOH Health Awareness Calendar. March is considered, has been declared as the Rabies Awareness Month. The empowerment objective for this particular pep talk is for the lay people to have a basic understanding of rabies in their health management. The contents of this pep talk will be the following. Why the Rabies Awareness Month? What is the Philippine government program against rabies? What is rabies? What is the prognosis of rabies? What are the preventive measures against rabies? And how can one contribute to zero rabies death in the Philippines by 2030? And then what are ROJoson's health advice on prevention of rabies on a personal level? Why the Rabies Awareness Month? This is to raise awareness on rabies as a health problem in the community and in our personal life. And this is also to highlight the importance of managing rabies in the community because it is common, it is causing a lot of death, and it is preventable and beatable if only every citizen is empowered and cooperates. This chart shows that there are more than 1 million cases of animal bites reported to the DOH from 2016 up to the present. So there are so many animal bites cases in the Philippines. And the reason for the increase because there are now more reporting coming in. Majority of the animal bites are bites from dogs and cats. And rabies cases are mostly coming from the dog bites. And then 72% of rabies are owned by the owner. There are owners that own the rabies. And then 88% of rabies cases were either free roaming or occasionally roaming, probably not really owned, but roaming around the streets. Rabies is a viral zoonotic disease. When you say zoonotic disease, it is transmitted from animals to humans that cause 59,000 deaths every year worldwide or globally, with 50% or majority of the cases occurring in Asia. In the Philippines, there are reported 250 to 300 deaths on the average every year, mostly among children below 15 years old, below 15 years of age, and those who are from the poor sectors of the community. Rabies kills. It is a fatal disease. 99% to 100% is fatal once symptoms are present already. At the moment, there is no specific treatment available anywhere in the world. Rabies is preventable, 100% preventable, and beatable. And that's why we are targeting now in the Philippines as well as worldwide to have zero rabies by 2030. The challenges on rabies: one, although such deaths are preventable, there is no treatment or cure for rabies once clinical manifestations of rabies set in. Second, the high cost of anti-rabies vaccine and immunoglobulin, the expenditure for medical consultations, and the loss of income are an additional burden to the regular Filipino family confronted with a potential rabies exposure. And third, in addition, victims of potentially rabies bites suffer anxiety resulting from the uncertainty on the consequence of the rabies exposure. So you really don't know once you're bitten by a dog whether rabies is present or not, or whether rabies will set in or not. What are the government doing for the rabies, against rabies? First, there's the enactment of the Anti-Rabies Act of 2007. And then there is the creation and implementation of the National Rabies Prevention and Control Program, or NRPCP, from the national to the local level, or the LGU. And then there are already establishment of animal bite centers. As of 2018, there were already 613. I think more will be coming. Okay. And then this increased number of animal bite centers have resulted to increased access to rabies post-exposure prophylaxis. The national program of the anti-rabies will include the following: mass vaccination of dogs, dog population management, health promotion, advocacy on responsible pet ownership, establishment of central database system for dogs, provision of pre-exposure prophylaxis for high-risk individuals, and then provision of post-exposure prophylaxis after exposure from potentially rabid or rabid animals. The Department of Health was mandated to ensure the availability and adequate supply of WHO pre-qualified human anti-rabies vaccines in animal bites treatment centers at all times. There is a strategic plan by the NRPCP, which is a plan from 2020 to 2025, with the overall and ultimate goal of declaring the Philippines as rabies-free by the year 2030. And before that, this is to target the ending of human death from dog-mediated rabies by 2027. The strategic plan will include strengthening the national program as listed earlier. So the question is, how can you help? And then in the health promotion, okay, they have this celebration of Rabies Awareness Month under Executive Order 84, in which March has been declared as the Rabies Awareness Month, celebration of World Rabies Day on September 28th, the development of IEC, information, education, and communication materials, massive health information campaign using the tri-media, and integration of rabies program into the school. So the question is, how can we help, or how can you help? So my suggestion is be empowered with the 4Ks: kaalaman, kakayanan, karapatan, kapangyarihan. Number 2, empower other people, especially children and the poor people. Dog vaccination, another program under the strategic plan. This is the most effective measure to control the canine rabies. The Department of Agriculture and the Bureau of Animal Industry takes the lead in mass dog vaccination campaign and provision of animal rabies vaccine. Again, how can you help? Be empowered, empower other people. If you have dogs, vaccinate them. If you have cats, vaccinate them, and help in the dog vaccination program. Another program under the strategic plan will be the dog population management. So this includes stray dog management through impounding, field control and disposal, surgical and non-surgical sterilization, and habitat control. How can you help? How can we help? So report to community leaders on the stray dogs, assist in stray dog management. Responsible pet ownership, another program. This adopts the strategy of promoting responsible pet ownership to prevent the spread of rabies. The public is advised to bring their pet dogs for an anti-rabies vaccination when they reach 3 months of age and yearly thereafter, provide proper nutrition, exercise, and shelter to their pet dogs, and not to allow their pet dogs to roam around to prevent contact with infected animals. Note, there's a law that penalizes owners of stray dogs. Animal bite centers or animal bite clinics or clinics. So this has been started by the DOH in 1997. For the government centers, it is usually called animal bite treatment centers. For the private ones, it is called animal bite clinics. There are a lot now of these government and private animal bite centers or clinics. Okay. For the private ones, some are hospital-based, some are standalone clinic-based. In the Philippines, there are 250 to 300 deaths every year, mostly among children below 15 years of age and those who are poor. So remember, always remember, rabies kills. Rabies is a dangerous viral animal infection and a fatal disease with no specific treatment available anywhere in the world. Once rabies develops, once there are symptoms of rabies, there is nothing that can be done anymore. The signs and symptoms of rabies, the more common type is the furious type, include the following: hydrophobia, or meaning fear of water, fever, malaise and headache, intolerance to noise, bright light or air, irritability, and hyperactivity. On the personal prevention level, these are my suggestions. Have your pets, particularly dogs and cats, vaccinated against rabies. Be vigilant against lick, scratch, or bitten by dogs and cats whose vaccination status is not known. Once exposed, meaning lick, scratch, or bitten, to dogs and cats, particularly those whose anti-rabies vaccination is not known, wash the wound immediately and thoroughly with soap and water for at least 15 minutes. Then go to an animal bite center or emergency room as soon as possible. Also, observe the involved animals for 14 days. If presence of signs and symptoms or illness or death, immediately report to authority, in which a lab exams for rabies will have to be done. So here is an illustration of what you should do once you are bitten, licked, or scratched by a dog or a cat with potential rabies. Immediately wash the wound with soap and water, with running water for at least 15 minutes. So you can also disinfect the wound with alcohol, and then immediately consult a doctor or go to the nearest health facility. What is an animal bite treatment center or animal bite center? It is a facility where you can avail of services about animal bites. These clinics may be attached into a hospital or to hospitals or as a separate centers. The centers have available vaccines and injection shots specially made to prevent rabies symptoms and infections. The World Health Organization has a guidelines on the post-exposure prophylaxis. There's also such thing as pre-exposure prophylaxis, meaning the prophylaxis is given before exposure to a bite, and this is given to people with high risk of exposure to rabies, such as veterinarians and those who are handling a lot of animals. Post-exposure prophylaxis is an emergency response to a rabies exposure, and this prevents the virus from entering the central nervous system, meaning the brain, the spinal cord, which would invariably result in death. The post-exposure prophylaxis, or PEP, consists of the following. So it also includes extensive washing with water and soap for at least 15 minutes and local treatment of the wound as soon as possible after a suspected exposure. Then a course of potent and effective rabies vaccine that meets the WHO standards, and the administration of rabies immunoglobulin into the wound if indicated. So the minimum are these 3 steps in the PEP: extensive washing, injection of anti-rabies vaccine, then administration of the rabies immunoglobulin into the wound, if indicated. There's usually a risk assessment of exposure to rabies after the bite. WHO has given this categorization. Okay. Category 1 means there's a touching or feeding animal licks on intact skin, but this is considered to be no exposure, category 1. In exposure in category 2, you now have the so-called exposure, and this is usually seen in persons who have nibbling of uncovered skin, minor scratches or abrasions, but without bleeding. So category 2, exposure. Then category 3, these are those with so-called severe exposure, single, multiple, transdermal bites or scratches, contamination of mucous membranes or broken skin with saliva from the animal licks, exposure due to direct contact with bats. So 1, 2, 3, 1 is actually no exposure, then 2 is exposure, and category 3 is severe exposure. So for the category 1, so what is recommended is just washing of the exposed skin surface. There is no vaccination. There is no administration of immunoglobulin. For category 2, aside from the wound washing, there is immediate vaccination, but no need for the immunoglobulin. But in category 3, wound washing, immediate vaccination, and administration of the rabies immunoglobulin. The schedule of vaccine shots, the anti-rabies vaccine schedule depends on the recommendation of the doctor handling the case, handling the patients. In most cases, the counting includes 0, 3, 7, 14, 28 days if there's a need for vaccination. And then it's important to remember that there's a need to complete the number of shots to make the vaccine effective. The number of shots required, a minimum of 3 shots may be given by the doctor depending on the patient's condition. If you had a vaccine before, the doctor may decide to give you a shorter course. Vaccination usually used in patients with animal bites against rabies, and against tetanus. For the anti-rabies, you're given the so-called, there are different types of vaccination against rabies. The cell culture vaccines, there are 2 types, purified vero cell rabies vaccine and the purified chick embryo cell vaccine. Then, after the vaccination, you have the immunoglobulin, which can come from 2 sources, the equine and the human rabies immunoglobulin. Against tetanus vaccination, you have the tetanus toxoid and immunoglobulin against from 2 sources, human or equine. So take note that the human sources, immunoglobulin, are more expensive. And then among the different vaccines, there are different brands and different costs. So any one of these will be acceptable as long as they are WHO and BFIT certified. So this shows that there are 2 types of vaccination, the intramuscular and intradermal. So for adults and children, it's usually recommended that the deltoid muscles be used. And then for children and infant, the small children, you can use the anterolateral thigh. So it's also important to remember that the gluteal region or the buttocks are not supposed to be used for the injection. So this illustrates the intramuscular injection of the vaccine and then the intradermal injection on this side. And then this illustrates injection of the immunoglobulin around the wound of the dog bites or the animal bites. The cost of the anti-rabies vaccination. So in the government institution, it's free. For private institution, the cost may be as high as 10,000 per session or as high as 50,000 for the complete set of vaccinations, such as in day 0, 3, 7, 14, 28. And then in the standalone clinics, which are usually the private animal bite centers, these are usually cheaper compared to the hospital-based animal bite center. So take note here that while the ABTC use intradermal vaccine administration, ABTC means mostly government institutions. They usually use intradermal administration. The private ones, the intramuscular, the animal bite centers usually use the intramuscular administration for anti-rabies vaccinations. Some quotations from private animal bite centers. Anti-rabies, about 700 per sessions times 4 sessions, so 2008. Anti-tetanus, 150 pesos per session times 3 sessions, or 450 for the total set. Then ERIG, or the equine rabies immunoglobulin. So the cost of one will be 1,007. So this is only used for patients with category 3 bites. And then another quotation here, anti-rabies vaccine intradermal, 700 pesos per dose times 4. Anti-rabies vaccine intramuscular, this is more expensive, 1,004 times 5 doses. Tetanus toxoid, 150 per dose times 3 doses. ERIC, 1,550 as the base price. Another quotation here will be using this type of vaccine, 2,000 pesos per session, but it needs 4 sessions, so about 8,000. Then another type of vaccine, another brand, 2,292. Then the ERIC one will be 2,661. For the toxoids, 176 pesos. And then for the human tetanus immunoglobulin, 1,158. Usually the human preparation of the vaccination or the immunoglobulins are more expensive. Then you have the clinic charge. Usually the private ones are more expensive. Okay, so you have it use of the animal bite center. The charge, the administration charge will cost you about 3,474. So this will give you an idea of how much it will cost when you go to animal bite centers in government, as well as in hospitals, as well as in standalone private animal bite centers. So some of the frequently asked questions: how long are you immune to rabies after vaccination? The answer is the rabies vaccine does not provide lifelong protection. Should I take rabies vaccine again after 3 months? Within 3 months of vaccination, if again a dog or animal bite happens, you need not take the anti-rabies vaccine anymore, only wound treatment. But if after 3 months of vaccination, animal bites happens, you need to take 2 booster doses on day 0 and day 3. Is there a single dose of rabies vaccine that is available? The answer is no. It usually comes in series or a course, day 0, 3, 7, 14, and 28 days, or some would give it at day 0, 3, 7, and 14, and then some would give it at 0 and 3. So you must be sure to complete the full course of vaccinations if vaccination is needed. This means that you will need to return to the health facility to receive additional vaccinations. And this is critical, as only one vaccination is not enough to ensure your safety. How many doses of vaccine will I need to get the PEP? PEP can be administered in one of 2 ways, as mentioned, either intramuscularly or intradermally. The WHO recommended option is the intradermal regimen that involves 2 doses of vaccine administered on each of days 3, 0, 3, and 7. This is supposed to be the most cost, dose, and time-sparing options. So WHO is recommending the intradermal regimen compared to the intramuscular regimen. 2 intramuscular regimens are also considered valid options by the WHO, although it's recommending the intradermal. And if the intradermal route is done, 1 dose of vaccine administered on day 0, 3, and 7, and the 4th dose between days 14 to 28. Or another option will be 2 doses of vaccine administered on day 0, followed by 1 dose on day 7 and 21. So, summary and takeaway in this particular pep talk: why Rabies Awareness Month? What is the Philippine government program against rabies? What is a rabies? What is the prognosis? What are the preventive measures? How can one contribute to 0 rabies death by the year 2020-30 in the Philippines? And what are ROJoson's health advice on prevention of rabies on a personal level? Takeaway in relation to patient empowerment: be always in touch with reliable medical information on rabies. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan, to gain greater control over decisions in the prevention of rabies in one's health management. With this, I end my pep talk. I hope I have empowered you, the lay people, to have a basic understanding of rabies in your health management. Before we go to the QA, question and answer, reminder, take the OLETE for Mastery of Learning and get the certificate. 50 OLETE certificates will entitle one to a voucher for a ROJoson telemedical consultation. Again, request, please type your feedback on the chat box during the open forum and before we adjourn. And now let's have a picture taking before we start the QA and interactions.